A healthy mother and a healthy baby. This is something we all want to see. And it is you, tomorrow's community health promoters, who have such an important role to play in achieving this. In this DVD, we look at the 3 major stages of childbirth. First, we see how to prepare not just the expectant mother, but all the family for pregnancy and birth. Secondly, we will see how we can help a woman giving birth and what we can do in the event of complications. Thirdly, we consider the strategy for safeguarding the well-being of the family after birth. For this DVD, we filmed about 300 kilometers south of Addis Ababa in the area around Awassa. We concentrated on 2 districts, that of Yirgalem to the southeast and Wondoganet to the east. Even in this richer, more fertile part of Ethiopia, spared the ravages of drought and famine, we face a challenge. Pause for a moment and think of 25 women that you know in your village. Current statistics indicate that 4 of those women will die in childbirth. Those women could be your mother, your wife, your sister, your daughter. And the tragedy is greater than that, because 30 times that number will suffer permanent damage because of a prolonged labor or lack of skilled care. You now have the opportunity to transform that situation. As we know, in the past it was the traditional birth attendant who cared for the pregnant mother and assisted with the birth. She had little or no official training, but she usually had a wealth of experience. And of equal importance, she had the trust and respect of the community. Under the government's new training scheme, you as health extension workers will draw on their experience while having the benefit of a year's training with refresher workshops. You will be attached to one or other of the government's health posts, which will be established in every kabali. Here there will be basic medical facilities, running water and electricity, using increasingly solar power. Amongst their other activities, these health posts will be a gathering point for pregnant women to be examined monthly by a visiting midwife. Above this, at the Warada level, there will be health centers. These will have health officers and trained nurses, with visiting doctors to deal with the more complicated births and to supervise such things as HIV clinics. In reality, you may not always find it like this, but this is the government's intention and its ambition. As anywhere in life, even more important than buildings and medical facilities are people. It is you, with your newly acquired knowledge and training, that will make the difference. Having a baby is not just woman's business. It involves the whole family. So Shawaye, a trained community promoter, tries to time her visit so as to be sure the husband is at home. On this occasion, she is with a couple who are considering another child. She wants to be sure they are making preparations for this well before the wife becomes pregnant again. So she discusses with them having an HIV screening. She checks whether the woman is eating the right sort of food, and knowing that malaria can cause a miscarriage in pregnancy, she tentatively inquires whether there is enough spare cash to invest in netting and other anti-malarial precautions. Particularly, Shawaya would encourage all women who become pregnant to have a TT, or a tetanus toxoid vaccination. Here at the health post in Aruma, they are implementing the government's campaign to see that every woman of childbearing age has 3 doses of tetanus vaccine, with special emphasis on providing it to all pregnant women. Thus, immunity is passed on to the child in what otherwise can be a fatal disease.
Aki ishite sa'atta konni mirmarasine mo'era faqadanya ikkota yeexame mahote ani munde dehannae sammine dimaramarrae sammine insa sidde urallati amate.
At the Wonder Gannet Health Center, a pre-pregnant woman has volunteered to have an HIV screening. It is something recommended to all women, especially these days, knowing that even if you prove to be HIV positive, antiretroviral drugs can reduce the risk of transmission to the unborn baby.
ጎመን ቫይታሚን ሲ አለው ውስጡ እና በሽታ ተከላካይ ነው። ጎመን ያው ቃራ ተጨምሩበታላችሁ ሽንኩርት ይገባበታል።
Even before pregnancy, nutrition, healthy eating is another important factor. Enterprisingly, Shawaya has put together a practical demonstration. A woman should be encouraged to think of what she eats even before she becomes pregnant, so that she builds up her own reserves of iron and folic acid. This will make her strong and reduce the risk of, for example, spina bifida in her newborn. She stresses that all the fruit and vegetables she has in front of her can be grown by everybody in the village on their own land. Nothing here need be expensive. Community health promoter Gannet, herself pregnant, prepares her own salad. Current thinking on nutrition advocates that the pregnant woman should try and have a mixture of 5 different fruits and vegetables a day. What Gannet is preparing is an example of this. A salad containing onion, tomato, avocado, green chili and lemon. What's more, it tastes great too. All that you have seen so far is ideally before pregnancy. But when a woman does become pregnant, one of your responsibilities is likely to be preparing a plan locating all the pregnant women in your village.
A high-risk mother, she's gravida 7, para 6, but she have only 1 child alive.
And especially identifying those who are possibly high risk. So when the midwife makes her monthly visit, you can confidently advise her. Your training will give you the confidence to refer women to the health center when a midwife is not available. Take the example of Bakalat, a community health promoter, who takes the initiative to visit a woman in an area who she suspects may be carrying twins. It is good to establish this early. She advises her to go to the health center where she will be examined by the midwife and possibly have an ultrasound scan. She gives her a signed form which authorizes the referral. Lomi, who is 18 years old, is expecting her first baby. Not only is it her first baby, but Lomi is very short, under 150 centimeters, a danger sign worth noting. She's given iron tablets too, as she looks a little anemic. Anemia is a shortage of red blood cells which carry oxygen around the body. Being anemic poses a threat to the mother and the baby's health. Sister Harag explains.
There are a number of ways to detect anemia. The first one is to see the patient's conjunctiva. It's a paper white conjunctiva. It detects that there is anemia. And the second one is to see the palms of the hand. The nurse hand is pink and the patient's hand is pale. The third one is to detect about the fingernail. When we press about 2 seconds for capillary filling time, the patient's hand is pale and the nurse hand is pink.
Let us look at this in more detail. Because this woman is severely anemic, when the skin beneath her eyes is pulled down, it reveals a very pale yellowish white color. Compare it with other skin colors and notice the difference. Here, it's healthy with a strong reddish color. While these eyes are not as healthy, neither are they severely anemic. They are somewhere in between. Sister Ejigayo has come to Aruma for the midwife's monthly visit. Checking a pregnant woman for anemia is part of an established procedure that you too will learn. Amongst other things, she feels the glands for signs of swelling, a sure sign of infection. A woman's breasts are examined and the nipples checked to ensure that they are not inverted. Requiring as much practical experience as theoretical knowledge is judging the position of the fetus. Sister Ejigayo explains.
On abdominal examination, first of all, I will do the fundal palpation. The reason why I do fundal palpation is to measure the height of the fundus, which means how many weeks she is. Now she is almost 28 weeks gestation. Secondly, I will do the lateral palpation. The reason why I do the lateral palpation is to find how the baby lies. Lateral palpation we are doing it in 2 ways. First of all, I have to do on my right hand, and secondly, I will do on my left hand. So by this, I know where the back is. Thirdly, what am I going to do is, I will see where the head is. This is called the Paulick's grip. That means the head is palatable and it is not yet engaged. Fourthly, I am going to hear the fetal heartbeat, whether the fetus is alive or not. Of course, we can know also by asking the mother if she feels fetal movement or not, but for us, we have to hear the fetal heartbeat.
A correctly positioned fetus has the head pointing down so that it will present first. But when a fetus is in a transverse position, as here, or in a breech position, with the possibility of feet presenting first, then there is cause for concern. Any uncertainties about both the position and health of the fetus can be clarified by an ultrasound examination. Here, a mother has come, seemingly carrying twins. Twins ideally would be positioned with both heads pointing down, but in this case they are both pointing up in a breech position. The doctor doing the ultrasound explains to the caring husband what he's looking at on the screen.
The chest, and I will follow until I get head. This is the head of one of the fetuses. Okay.
Ejigayo's routine examination continues.
After I have finished the abdominal examination, I am going to examine the extremities if she has any edema, but on this case she has no edema, as well as varicose veins. This is a premi-gravida mother. She is healthy. She is 28 weeks and has normal presentation of the fetus. But since she is preemie, all preemies are at risk, so that I will advise her to deliver in health center and take family planning at the end of delivery.
Edema, along with raised blood pressure, is one of the very real danger signs, especially as the woman approaches term, when it can be a symptom of preeclampsia, a condition that can be lethal. Sister Gannet.
This is a good case of preeclampsia. She presented yesterday from private clinic with proteinuria, edema of the body, and high BP or high blood pressure. And now still she has no more contraction. We are going to start pitocin drip to induce labor.
Preeclampsia is a very extreme form of hypertension, which can lead to coma or even death unless quickly treated. This is one reason amongst many for women living in the remote areas to have their babies at a health center or a hospital where basic emergency obstetric care or comprehensive emergency obstetric care is available. This is what the government is now encouraging. For most women, pregnancy is a special but not an easy time. Those of you who come from the rural area will know this. A woman still has to collect water, gather firewood, cook, attend to her husband and look after the children, while cherishing the new life growing inside her. It is your role to make sure she keeps healthy and strong, that her family are aware of her needs and support her, that whatever hardship there may be, it will also be for everyone a time of joy and hope and great expectations. Assessing a situation, knowing when to take action to avoid delay, that comes only with experience. But if you are working in remote areas, it becomes a vital skill, possibly a life and death skill, especially when helping a pregnant woman progress towards her full term. Those of you familiar with living in the countryside will know well why thinking ahead, making preparations for emergencies is so crucial. In your working area, you'll get to know the places that can't be reached by wheeled transport and the places that can, but not in the rainy season. Accessing health facilities is not just limited by distances and rough roads. The lack of money is a major deterrent. Tsahainesh is 28 years old and into her 6th pregnancy. With her 5 previous pregnancies, only one child survived, a boy who is now 6 years old. She desperately wants another, but after her previous experiences and the fact that she may now be carrying twins, she has been told she should go to Awasa for an ultrasound scan. But at the moment, she and her husband Gashuna have financial difficulties.
ሌሊትም አንተኛም እንዲው ጭንቅ ነው ቁጭ ብለን ነው የምናድረው እሱም እንዲህ እየተሰቃየ ያለቀሰ ያው ችግር ሆኖበት ነው እንጂ እዛ ለመውሰድ እስካሁን ያጨከነ የብር በጣም ችግር አለበት
Not only do they need money for transport to Awasa, they need money to pay for the hospital fees when they get there. And suppose they have to wait in Awasa. They know no one. So how do they pay for a room for the night? Gashuna asks why there isn't a community fund for such situations. You know, he says, there's more help here when someone dies than when they are alive. He's not the only one who thinks this. Recently, both in the Yirgalem and Wondoganet districts, a number of Kavales have established community emergency funds expressly for this purpose. Funds that are now available specifically for helping pregnant women in an emergency situation. Midwife Harag speaking in Wichu. In the Kavale of Moto, one of the elders seeks to reassure people this money will be properly used.
Aru illa no se wote hakecho woroni birre basho duchari cho qarranta noti wa ila madano tawana mite te terminan ba sorama nekige mita ta feti serena nafi ilte de bilan radi dandito hadoro no qarra sete taga ko de martawti nafi bidita gare no qarracho ta ko bala nafi agurte ka entenne hakko no hagi dame kite loge shat ka do kitano.
A mother listening stands up and gives her reason for supporting the emergency fund. Everybody is encouraged to contribute, both men and women, with the understanding that people give what they can afford and are given what they need. Part of your responsibilities will be to encourage participation in such schemes and observe how it's administered. After all, you will be close to the women of the village and will know better than most how well it is working. Difficulty of access, lack of money, both can prevent a pregnant woman going to a health center. But there are other reasons. In fact, for whatever reason, 90% of women in the rural areas give birth at home, mainly because they feel more comfortable doing so. So when, as part of your work, you attend a birth, remember that you are an intermediary, a critical link between the women who are reluctant to go to the health centers and the health centers themselves. Home births are when you will come into your own, when you will apply all that you have learned on your course. So ensure that the expectant mother, as she goes into labor, has quietness and privacy, that she is warm and comfortable, and that she's kept well hydrated. In other words, she's given plenty of water or more nutritious drinks. Above all, in the first stage, encourage her to be mobile, to get up and walk around. Let her support herself against the wall while you gently but firmly massage her back. It will help her to relax and give some relief from the contractions. Especially in the home where chickens, animals and young children may defecate. Be meticulous with your hygiene. And the gloves you wear, they're not only to protect you, but also to protect the mother from harmful germs, which could cause sepsis. So when you slip them on, watch where you put them before delivering the baby. In Wondoganet, Aberrash is known as an energetic and conscientious mother, well respected in the community. She is what's known as multipara, in fact grand multipara, as this is her 9th pregnancy. It is because of this that she has been advised to have her baby at a health center. Her labor, which seems to have started early, is going too slowly and she's showing signs of fatigue. So the trained birth attendant calls her husband. She asks him to arrange a gharry to carry Aberrash to the health center. Tadessa knows that fortunately he can call on the emergency fund to help with this. Eventually, the intention is that every cavalier will have such a fund. But this requires, amongst the community at large, a new mindset, a recognition that it is simply not acceptable that any woman's life or her baby's life should be in danger because the family cannot afford transport to a medical center or the user fees when they get there.
ስምሽ ማን ነው? አበራሽ ማ ከየት ነው የመጣሽው? እየገፋሽ ነው?
At Wondoganet's health center, Aberrash is welcomed by the nurse on duty and is given a routine examination. It's often difficult to predict the onset of labor. In this instance, it seems that Aberrash is not in full labor, but she is very tired. So it is suggested she goes to the health center's maternity waiting home until labor progresses. A facility like this represents an ideal situation. It's not to be found in most health centers. But again, such a facility is one of the government's objectives, an aspiration for the future. When Aberrash finally has her baby, it's a boy, 3.5 kilos, healthy, and for all the world to see, a very beautiful baby too. Let us now observe a safe delivery as one should expect it in a health center. Here the midwife, Ejigayo, has the great advantage of an assistant to help her. Salamawit, the expectant mother, is 18 years old and it's her first labor. Ejigayo is instructing her not so much to push, but with controlled breathing to, so to speak, blow out her baby. Notice that there is constant encouragement from both the midwife and her assistant. As she bears down and the head appears, Ejigayo rotates the baby so that the anterior shoulder emerges too. And now we see something that happens too infrequently. After the clamping and the cutting of the umbilical cord, The baby is not simply taken away from the mother, but immediately shown to her, so she can be the first to welcome it into the world. A healthy-looking baby with good, strong lungs. Notice that you always tie the cord in 2 positions, using an over-under, under-over reef knot that shouldn't slip. 2 knots provide a double precaution against bleeding. Remember, even a small blood loss at this stage can be catastrophic for the baby. Apart from its being clean, of course, make sure the cord ties are dry. Dryness helps the cord to eventually detach itself more quickly. Finally, when cleaning the end of the cord, check the 3 blood vessels are intact and that there is no further bleeding. It cannot be overstressed how important it is that the baby is given the breast as early as possible. This is not just psychologically important for the mother, it also stimulates the contraction of the uterus, which helps stem any bleeding, while the midwife with sustained cord traction removes the placenta. Essential here is that no part of the placenta remains inside the mother.
Now I am looking for completeness of the placenta, whether the membrane are not anything, if there is any retention. Complete, as you can see, it can cover all everything, so no membrane has left. Then I will see the lobes. So they are complete.
Ejigayo then takes a final precaution.
Now I am massaging the uterus, that whether to feel it is contracted or not, and by massaging the uterus and do slight pressure, so if there is any blood clot in the uterus, it will come out.
A good weight, 3.2 kilos. For the conscientious midwife, her work does not finish here. Immediate postnatal care requires not just the checking of the mother's blood pressure, pulse, temperature, and ensuring there is no vaginal bleeding, but also a careful observation of the mother's responses at what can be a psychologically critical time. Both mother and baby should be kept warm. The mother should be given something to eat and help to ensure that the baby is latching on properly to the breast. Somewhere in Ethiopia, probably in a rural area, you will become familiar with all these many aspects of childbirth. People in the Kabbales will look to you and depend on you for your knowledge, your sympathy, and your support. May you share with all the mothers that you work with their joy and satisfaction as they bring a new life into the world. So here we have a happy mother and a healthy baby. Or in this instance, 2 healthy babies, as Ejigayo's friend has had twins. It is now time to consider how we follow on from this. Many maternal and infant deaths occur in the first 2 days after birth, so it's vital that regular checks continue, taking the mother's blood pressure and taking her temperature too. A raised temperature may be an indication of sepsis. And check for foul-smelling vaginal discharge, another sign of infection. And always observe Is the baby feeding well? Is he crying too much? Is he warm enough or cool enough? When mother and baby return home, remind her not to let more than a month pass by before taking her baby to the local health post for its immunizations. That's usually DPT for diphtheria, pertussis tetanus, an injection in the thigh, and a BCG, a TB injection in the right arm. Finally, a polio vaccine is given orally. For mothers, coming to the health post is an excellent opportunity to share experiences. For you, it's an opportunity to see how well they are coping. As well as caring for their newborns and families, are they looking after themselves? Traditionally, a woman would have rested for several days after giving birth. But modern life and modern thinking usually doesn't allow for this. So a mother can easily find herself returning to her many family tasks too soon and wondering why she is feeling weak and depressed. And remember, postnatal depression, whatever its cause, is a very real medical condition, and left unrecognized can have tragic consequences. Sadly, another way a woman can be dragged down and her health jeopardized is simply because of just too many pregnancies and too many children. This is especially common in the rural areas. Ejigayo has some strong words for a husband with a sick wife and 7 children.
እግዚአብሔር እኛን እንድናቅ አይምሮ ሰጥቶናል ስለዚህ ያንን አይምሮአችንን ተጠቅመን ምን ማድረግ እንዳለብን መወሰን መቻል ብቻ ነው ያለብን ስለዚህ አንተም ቢሆን ሁሉ ጊዜ ቀን እንደዚህ የለፋ አንድ ቀን እኮ ጉልበት ይደክማል አይደል እንዴ ልጆችን ሳታሳልፍ የምትሰራው ተሸክመ ስለሆነ ይሄ ጉልበት ይደክማል ያ ጉልበት በደከመ ጊዜ ምንድነው እነዚህ ልጆች እጣፋንታቸው ምንድነው የሷ ፋንታ እጣፋንቷ እሷን ጉልበቷ እየደከመ ነው የሚሄደው በየጊዜው ስትወልድ ወይ አንዱ መውለድ ደግሞ በሞት እንትን ቢያደርጋት ምንድነው የምታረጋቸው እነዚህ ልጆች ቁጭ ብላችሁ ልጆቻችሁን ማሰብ ነው ያለባችሁ እናንተም እናታችሁን ነው ማሰብ ያለባችሁ ለምን አይበቃ
The Ethiopian government campaigns vigorously on the question of family planning. It is well aware that Ethiopia's birth rate is twice that of the world's average. A world where the struggle for living space and resources becomes ever more explosive. Hence it campaigns for the concept of child spacing, of parents themselves taking control of how many children they have and when they have them.
danchimate maganu uinonke diro maganu uinonke baatto ana woyambe herate asisa dafira
ninke umonke woyambe illoma osichonke woyesine ko eko ui ana illumokke ku ubifanna hakkui ana ila gabba anke
tikikkilanyu ille tikikkilete losine tabakka konni kawane kumore kyo osichu dasrem bakka kyo mari konne ro mora konne tikikkilanyu konne los taga gimmite ajjenna
After the community health promoter has got a lively discussion going, midwife Harag moves into talk about contraception and the different forms available, about oral contraception and the male and female condoms, about coils and implants, and probably the most commonly used method in this area, Depo-Provera injections. At the widow health post, women gather to have these quarterly injections. It doesn't come free. An injection costs 2 birr, but for a whole 3 months, a woman does not have to worry about conceiving. Today, though, the world is confronted by a new challenge: HIV/AIDS, a potentially fatal virus for which there is as yet no known cure. Many parts of Africa have been decimated by this disease, and with constant travel across borders, its tentacles stretch ever deeper into the continent. In the city, night falls, clubs open. People meet, dance, make love. For all of us now, this is a deadly lottery. At the Wondoganet Health Center, a young couple receive HIV counseling and wait for the results of their blood tests.
HIV ኤድስን የሚያመጣ የኤችአይቪ ቫይረስ በደም ውስጥ የለም ማለት ነው። ሲመረመር ግን አይታይም። ምክንያቱም 90 ቀን ካልሞላ ወይንም 30 ቀን 90 ቀን ወይንም 33 ወር ካልሞላ ኔጌቲቭ ናቸው ማለት ነው። ሰው
The message is clear. Unless a person is confident that they are in a totally monogamous relationship, precautions must be taken. And that means whatever contraceptive device you use, only the old-fashioned condom protects you from HIV/AIDS. Thus, it's important that every man and woman knows how to use them. And that protection, of course, is not just against HIV/AIDS, it also protects against other sexually transmitted diseases, such as syphilis, gonorrhea, and chlamydia. There may come a time when a couple decide they no longer want any more children, in which case they may seek your advice on a finite form of contraception. This is a vasectomy for a man and a tubal ligation for a woman, commonly known as sterilization. Both procedures are relatively simple operations, usually requiring only a local anesthetic and taking about half an hour. Sterilization involves cutting and tying of the two fallopian tubes.
This is a fallopian tube through which passes the egg from the ovary of the mother. Now we're ligating it so that it will not bleed. Because this mother has 6 kids, she agreed not to have any more kids.
For all practical purposes, it's an irreversible operation, so it's not an easy decision for a couple to make.
This wound will heal in a matter of 72 hours.
Although you are unlikely to be involved in the operation itself, you may well feel like trained birth attendant Sunari, that you can still offer post-operative comfort and support. It is, after all, a vulnerable time for a woman. Sunari follows up a few days later by visiting her at home, where she is surrounded by her family. Although still feeling a little discomfort, she is in good heart. Here is a poor family living in a remote area. No doctors come here, nor do any nurses or midwives. But you are from this community. You are part of this community. You are their advocate. Accept the challenge. Understand your importance and use your training to make childbearing in your qabali a safe and joyful experience.